Hi, I'm Nat, and today on PACOP Clinical Bites, we are looking at the Symptom Assessment Scale, or the SAS. The SAS is part of the PACOP suite of assessment tools. It is a wonderful tool and it's an important tool, arguably the most important tool because it is resident rated. Why that is important is because this is a chance for us to find out from the resident what is actually bothering or distressing them, as opposed to what we, the clinicians, assess when we clinically assess a resident. It measures distress from seven common symptoms, the most common symptoms that people experience at end of life. Plus, there is also the option to measure anything that doesn't fall into those seven symptoms in the other category. When you get the assessment scores from a resident, we say it is over the past 24-hour window that you should be looking at, not just the time of the assessment. The SAS operates on a numerical scale of 0 to 10, where 0 is no distress and 10 is severe distress. What is really important for us to tell you is that distress is very different from severity. We as clinicians are probably more used to measuring things on a severity scale, such as pain, but distress is more like a bother or worry or concern to the resident, things that are worrying them, things that maybe keep them awake at night, things that they think about, things that are preoccupying them. Something that is really bothering to them is what we would rate as distress. The SAS is an amazing tool because it really gives us the opportunity, number one, to connect with the resident and actually sit down and have a conversation with them and find out what they are thinking. The best way to find out accurate information is to actually be interested and to have it during the course of a discussion with the resident. Don't treat the SAS as a checklist where you just go by and ask for their SAS scores for each symptom. Have it like a conversation. For example, Bob, how is that pain in your knee bothering you today? I know yesterday we had a chat about it and it was really bothering you. You were driving you crazy. Some changes were made, and I'm just wondering, is it still bothering you as much today? Or, Bob, I noticed that you weren't eating much at breakfast today. Does that bother you? I mean, it may not bother Bob, or it may bother Bob. The point is, until we ask and we frame the question in the right way, we won't get the right answer. So it's really important that we ask for the information in the right way. The SAS also has the capacity to be rated by proxy. So if a resident is unable to communicate, perhaps they are at the very last stages of life, and they are no longer able to verbalise or communicate with the nurse or with the care staff, it can be rated by proxy by either clinician, and that includes by the care worker or by the family. But of course, as a tool, resident rated is best because then we get to find out exactly what the resident is thinking. Here is some of the resources that we have for the SAS. We have this great SAS ruler, which is it comes in two sizes and can be getting quite a big size. On one side, you've got the face scale that corresponds with the numerical scale. And the other side, you have the list of symptoms. This is really great for residents may, not really it's hard sometimes for them to pick a number. You found out that something is bothering Bob. His knee pain is bothering Bob. But when you're asking for a number, he's like, oh, in cases like that, you can just show him this rule and say, okay, Bob, which face? Which face corresponds to the amount of annoyance that the knee pain is giving you right now? Another PACOP clinical bite, we will talk about the problem severity score, which is the PSS. Hopefully you've seen that already or you're about to see it. And why we mention that here is because the SAS works really well with the problem severity score. The reason being is that the SAS gives the resident's viewpoint about what's important to them, what's distressing them, what's bothering them. And the problem severity score is a clinician rated tool. So that allows clinician to use their clinical skills and assess the resident and then score the resident within that tool. When you put both of these scores together, you get a holistic picture of the concerns, problems, and issues that are causing a problem for the resident, and therefore what we need to act on and make allowances and interventions for in the care plan of care or the care plan so that we might meet these needs. And that brings us to the end of this PACOP Clinical Bite. Thanks for watching. I hope you go ahead and watch the PACOP Problem Severity Score and all the other ones we have. And if you want any more information, including further definition of all our tools, you'll be able to find it on our website. Thank you.